I'm going to be speaking about, at a very high level, about the broader health implications of climate change, because I'm sure that's extremely familiar to folks at this meeting and well known. I think where I'm going to do a little bit of a deeper dive is on health disparities and how climate change amplifies health disparities, and with a particular focus on people who are inadequately housed or experiencing homelessness, which is, of course, as David mentioned, the main concentration of my research over the years. So just a few disclosures here. So this work was funded by a tri-council. So NSERC, SSHRC, and CIHR came together on this program called Living Within the Earth's Carrying Capacity. It was a knowledge mobilization program that got the show on the road here. I have no conflicts of interest to disclose, and I'm representing really the work of many people. Several people are down here. Behind that group is a global network of experts who've been engaging for the past year and a half or so. And of particular note is Maria Bezgrabelna, who is my grad RA up at York University, who's done tremendous work in the background here. There's loads to read, more than you'd ever want to read probably, at the website here. Can certainly share that afterwards. It's got all of our publications and reports and blogs and newspaper articles, all that stuff. So lots to check out there if you want to read more on this topic. So as I mentioned, hoping to cover some ground at a high level on health, get into disparities in particular, and then use homelessness as what I think is a good case example of how these disparities play out. So by way of a little bit of background, just how I got started on this, there is a disclosure I need to make, and that's that while I've spent many years working with clinically and doing research with various populations experiencing homelessness over the years, young and younger, youth and adults in many cities, and built interventions in that space, which I'm still doing, still trialing interventions for homeless youth in particular. I wouldn't profess to be a climate scientist. I think when I started into this area, whatever it's been, 2 years and change ago, I was probably at the level of a concerned citizen. So doing some reading of the New York Times and some books and stuff, and trying to, keep on top of things and doing my best there. But I was out for, I don't know about you all, but I find when I can get away from the email barrage, I can actually think a bit, which is kind of nice. And so out for runs, I've run winter and summer and everything in between. So I was out for a winter run I live in the West End in Parkdale in Toronto, out on the lakefront there, running up and down a snowy hill. And I got thinking, it was at the time of year where you get the out of the cold shelters. And I was thinking about, the city's response to weather and homelessness. And you've got the warming centers, the cooling centers, people going out, doing outreach, giving out water bottles. There are citizens like myself walking home from work where I'll give water bottles to people who are in encampments and stuff like this, just trying to, help people cope through weather extremes in a city like Toronto, which arguably has, less weather extremes than most places in the world. But it struck me, I'd never read a paper on climate change and homelessness. And, certainly weather comes up routinely as people talk about suffering and dying in temperature extremes, and that comes up in the media and here and there. But so I did what I often do, is I started a scoping review on the topic, just being kind of the academic and a bit of a nerd that way. I kind of like scoping reviews as side of the desk projects. And it kind of confirmed what I thought. There were a few papers out there, about 19, I think, in that systematic review came out, or a scoping review, but really not a lot. Like, given the scale of the issue, it's really minuscule. So around the same time, the Tri-Council came up with this call for proposals. And this was the kind of call for proposals that makes your colleagues dislike you. So it came out in early December, and it was due in the beginning of January. So just when everyone's finally taken a breath, ready to work on their own papers or take a little vacation, here comes Sean saying, "Hey, this call came out. What do you think about coming together on a proposal?" And so my colleagues, most of them named up front there, so they were kind enough to say, "Sure, you do all of the writing, and I'll put my name on it, maybe contribute a bit. But buddy, we're heading into a vacation." So anyways, it came together, and we were fortunate to get funded. We were, in fact, one of a very small number really looking at poverty and health disparities and climate change. And that's what got this show on the road. It's been a journey of a lot of learning for me on the climate change. And this group, I think I can, really as obvious stuff covering here. You all are very well aware of what's happening with climate change. and the inequities that play out, be those inequities from individual levels to regional and country levels, and just really, lagging and inadequate responses at all levels is kind of standard stuff that I'm sure you're having many discussions about. So getting a little further down the road here, in terms of health impacts, the best resource that I've come across, and I'd encourage if you do want to have a spin through it, is the Lancet Countdown, which is a really nice systematic review and kind of collection of expert opinion on what are the many and complex health impacts of climate change. And they update this pretty routinely. So this is the most recent one that I'm aware of. I think it's October this past year came out, but this is a great resource. Some of the points to highlight here is it's often a story of interactions. So interactions between weather extremes and existing vulnerabilities. So you see cardiac and respiratory illness. You certainly see, as was evidenced, sadly, in British Columbia last summer, the number of elderly people who passed away, obviously, from being in environments where they were getting too hot and during the heat wave, amongst other challenges, and just seeing the deaths during the pandemic of people locked in rooms without adequate air conditioning, these sorts of things. So those vulnerabilities play out. Globally, there's evidence about greater risk for elderly, the very young, including kind of in vitro neonatal exposures to risks via mom and children. You see as well, there are papers coming out about not just, obviously climate change has impacts on people's ability to work and be out of doors. I did construction jobs to put myself through undergrad, so I can attest well to, in the summertime, putting 10 and 12 hours in outside, and that was kind of before these impacts were really underway, and trying to work in that sort of frame, it can get intolerable. But on the health side of things, of course, lacking work is bad for a person's health, but exercise too is extremely important, obviously, for health, cognitive health, and everything else, and that gets reduced in climate with climate impacts, pollutants, and particulate pollution, and then of course heat, and then there are extreme events which cause injuries and so on, and all of the other impacts coming out of food, water, energy, and security, and so on. The one area which it has some emerging evidence, which is something that I think may be less intuitive. While the evidence is a bit up in the air about climate change and things like war and sort of countrywide revolt, although I think that's a hard thing to get causal evidence on, there is a decent amount of evidence emerging about interpersonal violence, and just seeing, in jurisdictions such as Australia during the fires, you see these spikes in domestic violence and interpersonal violence. That, of course, that will play into people who are more likely to experience violence, such as women. So this is a very fast spin through some of the health implications of climate change that's in the Lancet report. In terms of mental health, the most recent reviews that I found, the most recent one that I've seen so far, systematic reviews 2020, at the time was just a bit over 150 papers. It's probably every year, it's been, I guess, about a couple of years probably since that review is done. I'm sure this number has maybe even doubled. There's a rapidly increasing attention to this area. But it is emerging. It's certainly not as well developed as physical health. And, it's kind of, the evidence that's coming out, it's very descriptive. These are mostly studies that are describing associations between observations about weather, whether they're extreme weather events or heat waves and so on, and the kinds of mental health impacts that are observed. And really, it's not that terribly specific. It's basically saying across the board, mental health suffers. So anxiety, depression, trauma comes up, substance abuse. All of these pieces come out of it. And this is true for extreme weather events, heat waves. I've already mentioned the violence piece and disparities. Suicidality has been associated with weather extremes. And I guess the area that's a little more nuanced than this, and I should say that the vast majority of this literature is really kind of descriptions of associations. It's hard to establish causality, and there's really very little on interventions, although it's starting to come about. There's some stuff about, interesting stuff coming about youth engagement and youth empowerment, and how you bring young people together to offset the hopelessness, helplessness, anxiety that comes with climate change, youth, of course, being particularly impacted. So there's some interesting emerging stuff there, but there's not a lot. The more nuanced piece that's of interest is these terms. I'm sure you're familiar with: ecological grief, eco-anxiety, sort of this sense of the sense of a loss of place and home, sort of expanding home beyond just the concept of house. And of course, with Indigenous populations whose histories, cultures, interactions and well-being is so tied in with the natural environments that these cultures are living and subsisting in, these cultures and communities are being the most impacted, and there are some unique mental health implications for Indigenous populations. And I've already covered some of the disproportionate impacts. So that's kind of a bit of a rapid fire summary of the mental health piece. It's not terribly well focused or indexed to specifics or causality, as I mentioned. And certainly a huge gap is, what do we do? I don't know if that's in the next slide. I cover it. Yeah, I might be jumping ahead a little bit, but it might be good to talk about here. So there's a guy named Gary Belkin in New York who's created something called the Billion Minds Institute. And he's not the only one. There are others are looking at outside of the frame of just mental illness and just describing challenges. They're looking at how do you create, from a mental health perspective, resilient and ready societies and communities who will be empowered, enabled, and hopeful about what can be done. And his point, and it's a good one, is if communities, individuals, and the rest are feeling hopeless and helpless and anxious, it's not stuff that's going to motivate people to do a lot. People will tend to hunker down and just kind of not engage, or engage in ways that aren't productive. And so his group and other groups are trying to look at how do you actually engage people in as positive but realistic a frame as possible and become action oriented. And again, jumping ahead here, I know I've been a part of many discussions where people will talk about, oh, well, the green bins and trying to, make your front yard less lawn and more ecologically responsible. This stuff is not going to do anything. It's the systems level, policy level responses, whole government responses. And that's very true. But I'd argue that I think it's not entirely true, in the sense that, having my small front yard not being covered in a nice lawn that's got loaded with pesticides and so on, sure, that small effort isn't going to do much for climate change. But what it does do is it connects me to the effort and makes me feel engaged, and it will make me vote and think in a bit of a different way. So I'd say there are indirect ways that some of these small efforts, a green bin isn't going to do hardly anything, but being tuned in and feeling like you're doing something, I think does something psychologically to a person. So I think that's where Gary Belkin and others are on an interesting path. And I think there's probably a lot more to be gained from that than describing just suffering that's coming from this. In fact, I'd say with 163 papers as of 2020, that may even be enough to say that, yes, climate change is causing people to have mental health challenges, and let's go from there. So okay. And in Canada, I'll talk about Canada specifically, very similar themes. There's nothing much different from the general literature. One unique aspect, as you might imagine, I've probably heard about quite a bit, is for Inuit and other northern communities, is where, obviously there is ice pack melting, and that has all kinds of implications from hunting and subsisting on through to cultural impacts, and of course this is all an extension of the colonial injustices and atrocities that happen in the far north. There are some unique impacts there that go beyond sort of the other places capturing anxiety and depression and so on. We have some opportunities, and this is commented on in some papers and some of the reviews. So the idea of, we have the benefit, albeit, underfunded and not that well organized, is we do have universal healthcare, which does present some opportunities. And we do see some examples of responses. So Alberta, in the response to flood, dedicated some significant funds to mental health impacts. So seem to be some opportunities for organized responses, and for example, now the Canadian national effort to develop a national strategy in response to climate change. I'm part of the health table there, as advising on having a health silo, or health bucket, I shouldn't say hopefully it's not a silo, health bucket in that effort, and having a science bucket in that effort. So there are these larger scale organizing pieces that are happening in Canada, which I think are quite promising. Albeit I keep, out of some of you are part of some of these meetings, the tone is not, to my mind, not action oriented or fast enough. It's feeling a little traditional to me in the sense of, well, let's study and let's come up with a plan to get some better data. And in 5 years, we can have a data infrastructure and we can have some assessments of what's happening. And I feel like we need to get into a frame. This isn't, we can't go at the pace we do historically in Canada, where I think we need to move on to studies of assessing the impacts of policy, rapid assessments of interventions, allow some things to fail, and just you get data good enough to be acting. So my worry is we're going to be Canadian about this and spend a lot of time trying to get everything perfect before we start digging in and trying things. And so anyways, I'll get off my soapbox, but that's something that I sound off a bit about at some of these meetings. Okay, other stuff just of interest, again, maybe covering stuff you already are aware of, is, and this is in the Lancet report, so they've done some research and found that when women are better represented in positions of power in governments, they have more robust climate responses. On the Indigenous side, obviously population is not just impacted the most, but there are opportunities to engage on responding. I think, certainly my exposure to the field, we're getting pretty excited, as we should, about system dynamics and looking at complex systems responses to climate change. This is really stuff that that Indigenous cultures have been thinking about for many hundreds of years, about interdependencies. And it's really, our system science, a lot of these pieces is just sort of a framing of interdependencies. And I think that there's a lot to learn there. And some other pieces that are coming out is the high level, just federal government sort of responses is only going to go so far. There's a good amount of evidence about local community engagement, enabling communities. I covered a fair bit, and I've already talked a bit about Gary Belkin and his work, which is kind of interesting stuff. I don't know where he's going to go with it, and it can be hard to find a focus in that area, but still, it's an important effort. Okay, I'm going to take a quick breath here. And shift gears. I'm sorry, and I'm kind of maybe a bit motor mouth there going too quickly, but tried to cover a lot of ground because I'm not sure with this group, I might be just droning about stuff you've heard a ton about, but I just wanted to make sure we're sort of level set a bit on the main issues. So I'm going to cover homelessness. And so I've already given you a bit of background as to why I was interested in this. And here are a couple of pictures. So we're about to literally in a couple of weeks launch our global health response framework for climate change and homelessness through the Homeless Hub and various social media channels. We've been banging away at this for months now. Just I think we've decided to say it's good enough. With these kind of framework documents, you could spend forever tinkering. So and the person doing copy editing finally said, okay, are we about done? So we've got to call it and release it, and we're going to do that soon. But along with that, the reason I'm giving you this background is we engaged our network, who are so kind. I have to say, during the pandemic, I mean, I had my kids jumping around me this whole time, is people really responded around the world to this email from some dude in Canada saying, hey, do you want to do something on homelessness and climate change? And really engaged. And some of the group shared some images, and we tried to do this very ethically, is not exploitative pictures of people suffering, but just really trying to capture lived experience context, because as you probably have experienced, we need to bring these issues to life if we're going to get the public and policymakers interested. So on the top left is the Kakuma slum in Kenya. And a colleague who's got an affiliation with York, Solomon Jenga, who does work out of Kenya, shared this picture. So there it's often flooding, which of course on its heels brings illness and death, especially amongst infants. And there's a lot of refugees fleeing climate change and exposed in that environment. And in the lower right there is an image from Brazil, is sort of looking at how individuals in Brazilian cities take found materials and try and create climate resilient structures against cold and heat, just based on what they can locate. And so we've got a bunch of these pictures that we're going to have up on our website shortly. Okay, so I'm going to share some info now in this area, and then I'll wrap once we get the homelessness stuff covered, and we can have a chat, which would be nice. So what is behind this is we did a couple of systematic reviews, the one I mentioned already, and we did a review of reviews. This was my first, is we wanted to capture more broadly the issues of housing and poverty and climate change. And there, because we did not have all the time in the world to look at the many hundreds of papers that would be under that huge umbrella, is we did a review of reviews, because we wanted to have a bit of a system lens and a review of reviews kind of lends itself to that. We held a whole bunch of think tank events. As I mentioned, really generous people with their time because the literature is inadequate, frankly, in this area. So we really needed to get the smartest people we could find in this topic to tell us what they think. We use the literature reviews as a jumping off point, but really a lot of the framework that we built, any information we have is from these think tanks. And I get to one of them too. I ran a 4-hour think tank a year ago, January, and never again. People were so great, so engaged, but I don't know if you've had if you had the opportunity to try and lead a 4-hour virtual event of any kind. It's like I basically went to bed right after. It is so, I never thought it would be so exhausting, but we got some great info, some stuff we had to grapple with. I mean, these are fuzzy issues, so we had a hard time trying to figure out what are the definitions, terms, parameters, and if there's one really overriding thing that we're all committed to, is we do not want to build a net new thing with new terms and trying to bring a new focus, because I don't know about you all, but I find this space can get intensely confusing. There are so many parallel efforts with so many overlapping, that are 98% the same, that it gets really confusing to try and figure out what to pay attention to. And I think this is actually a threat to the overall response effort, because it really scatters people's attention and people's focus. So we don't want to contribute to confusion. What we want to do, and this is why I'm thrilled to be engaged with the World Health Organization and their health response documents that are coming together, and the Canadian effort, is really just want to add in our perspective on the importance of homelessness into these larger organized efforts, get our terms aligned and get lined up on the policy side. That is a passion of mine, as much as the topic, as I don't want to contribute to confusion. So what did we learn around homelessness? So the impact of climate change and homelessness breaks out into two themes. One is super obvious. So obviously people who are lacking shelter are the most exposed to the elements. And as well, the less thought about one, I would say, is about migration. So of course, there's loads of stuff on climate change and migration, whether it's rising water levels, storms, parched landscapes that don't support farming or subsistence anymore. But what we're trying to articulate here is migration to what? And the to what part is, for many people who are impoverished, it's migration to, increasingly inadequate housing and outright homelessness. I showed that picture of the slum, the largest slum in the world, I should say, in Kenya. And that's an example of, those are folks migrating from rural settings to an urban setting to try and make a go of it or survive. And that's where they land, is in really desperate scenarios housing wise. So those are the two main themes. Obviously, they relate to each other. If you migrate to homelessness, you're more exposed, and so on. So I'm going to show some slides that aren't good, in the sense there's just way too much in them, but I'll just summarize. And here you can see my 1990s stats training going in full effect. Is I think in regressions, and I know regressions, multiple regressions is absolutely the wrong statistical approach for most climate change problems, but it's kind of, unfortunately, it's welded into my brain, and neuroplasticity takes a nosedive after 30. So it's still kind of stuck in there. So for migration, just trying to break it out into sort of primary and secondary effects. Like obviously a storm destroys your housing. That's a direct effect. Other issues are overcrowding and food and water insecurity, and pieces you can read about here, considered more secondary. I mean, if it's your third house in the Florida Keys and it's destroyed in a storm, you've got some nice insurance and you can go get yourself another house. I'm being very facetious here, but it's sort of the moderators are what's important, is what's going on with the individual in the country that really will determine those outcomes that I'm interested in. And that's where people are landing in situations of poverty and homelessness exposure, and all of the mental and physical health challenges and loss of life that comes with that, exposure to violence and so on, loss of employment, all these pressures. So this is a bit of a scan of what we know about migration so far. And I actually can say that we sure haven't landed. There will be feedback loops and interactions and geographic and population complexities that we just don't know enough about yet. And these are horrible stats to try and assemble. I had years ago, this would be maybe 20 years ago, I was a co-leader on a homeless count in New Haven, Connecticut, which is that's probably going to be one of the easiest places in the world to do a homelessness count. because it's sort of a mid-sized American city, decent number of services to kind of connect with and find people. And I vowed never again. It was so intensely difficult to try and do a count at a city level of homelessness. And you can only imagine how hard it is to do get these population level data in countries without these sorts of infrastructures and resources, or even interest in capturing this. So very hard data to get. Exposure, I think I've covered this pretty well. There's the direct exposure and secondary, such as being exposed to various kinds of illness and disease, all the moderators. And I think an important thing to tease out with moderators is the vast majority, arguably all people who have been experiencing homelessness for any significant amount of time, these are folks whose health is not good. Mental and physical health challenges are very common. So the exposures are happening to people who are already quite unwell in most instances, who don't have access to many of the social and structural resources that others have, who are experience a great deal of discrimination. And then the outcomes, and there are some data that's, again, it's associations and so on, but looking at things like death rates when there's a heat wave amongst homeless populations that suggest pretty strongly that people are dying and suffering a great deal when there are weather extremes. A lot of the data that we have, though, is just coming out of North America, mostly the US. So we're in this strange paradox in the space. Maybe this is probably true in other topics where we have the most data about the least affected people. Not to say that if you're in Arizona and you're dying in Phoenix from a heat wave, that's not significant, but from a population perspective, there are other parts of the world that have far more impacts, and we have nearly nothing. And so huge gaps in the literature there. And so this is the right audience I've already talked about the systems thing. Again, this is something I probably don't need to go to town on, but a few things I'll just talk about. So negative feedback loops, it's like the vicious cycle of poverty or homelessness. You can kind of see that, once a person loses, even if it's semi-adequate or inadequate housing and becomes homeless, it's so much harder to turn things back. The person's well-being declines rapidly, and the complexity of responding is more expensive and more complex. So it's a negative feedback loop. It's not like it just gets incrementally a little harder, it's exponential. And this happens around all kinds of issues surrounding this problem. Leverage, I think, is really important, is because this is a complex problem. Like in any homelessness issue, you could be doing 25 or 30 things at any given time to intervene, but we'll never have the funding anywhere to do everything that you need to do all at once. So we need to get better data to understand what are those points of leverage where you get the biggest bang for the buck intervening. So an example of a severe mental illness example, I find that's one of the clearest ones I'll just throw out there about leverage and severe health impacts and challenges. It comes out of low-income context, where I did some case studies a bunch of years ago, is social enterprise. So social enterprises are a great example of a leveraged intervention for impoverished people whose mental health is challenged. And because a social enterprise provides a person with a little bit of money, it gives them a job, and jobs are always good for people's health across the board. It reduces stigma because people see that people with a diagnosis like schizophrenia can work and can be productive. So it reduces stigma at individual and community levels. And these are relatively inexpensive to build. So you've got this intervention called the social enterprise, which has a lot of impacts in a lot of different areas against the amount invested. So that's what I think we need to try and do more of in this space. And we need data. I've kind of gone to town on that already. So what have we been doing so far? It's not good, I have to tell you, in terms of what we've done so far. People experiencing homelessness are very rarely included in disaster response plans. And this leads to when things like hurricanes happen, first responders are not able to find them, don't know how to engage them in emergency and crisis response, and there's just no plan. And so this is going to be leaving people suffering and dying because they just haven't been included in strategies at city levels usually. In climate remediation and adaptation plans, not very often included. And you can see plans backfiring. You probably have talked about this before, where, for example, expensive retrofits of homes that can just be out of reach for poverty, for inadequately housed impoverished populations. The greening of cities, when you put in more parks and you put in more trees, what you see is the cost of living increasing in those neighborhoods, and it's a amplifies gentrification, pushes out people into scenarios of greater poverty and homelessness. So these are examples of scenarios where is this not thought being given to impoverished people. Other stuff, yeah, reactive responses. This is the most common thing. I've already talked about giving out water bottles, trying to talk to people about what heat stroke looks like. And hey, if you see your buddy is going through this, then this is an emergency and you need to call 911, you know, that kind of stuff. That is happening. And generally, when it's done at its best, Australia's got some great examples. Is you do it with peer outreach and co-design. Is the worst thing, and this is always the case in homelessness, is the worst thing that you could do is have someone like me thinking, I think this is a good idea, we should give these folks this and talk to them about that, and I made this great pamphlet. It just never works. So you need to do co-design, peer support engagement, and that's where you'll find people and you'll speak in ways and provide resources that will actually be relevant. And then you know, opportunities to move upstream. I think the national housing strategy and some of the federal level stuff that's happening around homelessness. This is actually the latest budget has a good injection of cash into homelessness. This is good stuff because ultimately, way better than trying to give out water bottles is why in a rich country like Canada, why we have people who are chronically homeless is really nonsensical. So if we can have far, far fewer people who are experiencing extreme poverty and homelessness, a good 2/3 of my talk becomes, at least for Canada, irrelevant and not needed, and that will be great. It'll be different for other parts of the world where that impetus and infrastructure isn't happening, or if the Canadian administration changes, and we have had ones in the past who have very little or no interest really in doing much about homelessness. All right, so concerns, talk a little bit about the Canadian end of things, and then head into some teasers from our framework. Migration isn't really a topic yet, I've found, in terms of discussions in Canada, but I think it's going to be increasingly so as I'm thinking about impoverished people pushed out of housing due to fires and things like that, you know, without good insurance plans and such. That's going to be happening. And people from other countries, that's already happening, are going to be looking to Canada as a place of refuge. So I don't think I'm going to go too much into this. I mean, I think I've already covered a lot of this and want to get into our conversation. COVID-19 is interesting in the sense, it has been horrible, but an interesting aspect of it in terms of homelessness, a couple of things have happened that have been actually not too terrible. So one is, you will have seen, of course, the many efforts, and this is in the UK and the US have done this too, is to get people out of these terrible and dangerous congregate living environments, these shelters, and into hotel environments to separate, to address pandemic threats and to public health, as well as to the health of people working in the space and all that. That's interesting to me because it kind of shows us what we can do when we're sufficiently motivated at a systems level. We can get people out of terrible shelter environments that we know are dangerous, and they're terrible places to work too. People burn out routinely in these places, and we can do this. So it kind of showed us that when sufficiently motivated, we can do something big. I think that's positive. And then the other thing as well, some of the narratives around homelessness during the pandemic talked about interdependencies, like it's no longer charity for the poor, or these are some people who are, and I'll use the derogatory terms here on purpose, schizophrenic criminals, addicts who are just, they made their bed and they're out there and they need to get them out of sight or get them in prison, or, you know, like these are the kind of narratives that are out there. But I think during the pandemic, we learned a little bit more about interdependencies and how looking after our most impoverished is in fact a matter of looking after ourselves as a society. So I know that I won't exaggerate this and think that this has changed everything, because it hasn't. Toronto is busily putting people back into congregate shelter environments as quickly as possible. But something's been demonstrated, which I think is of interest. So response framework. This is kind of the home stretch for us. I'm much less interested in describing problems as sort of looking at, with the wisdom of the many people who've come together on this, what we can do. I've already talked about this. I've talked a bit about alignment. There are many alignments, and we have tables where we align all of the recommendations we make against some of the major efforts in the space. We're trying to keep it brief, and this is a needle to thread here. You can't get too specific, but if you're so high level, it just will become, you know, no-brainers, which won't be that interesting. And we're really trying to differentiate as a function of a few things: the kinds of climate-related pressures, the kinds of populations, and the kinds of social, political, and geographic contexts we're in. So I have to say this has been really challenging to do, but I think we've landed relatively okay, and leaning on general principles, as I mentioned. So A few cross-cutting things. So no matter what specific recommendation that we were making, there are a few things that cut across everything. So I've already touched on this, is having a prevention emphasis and generating data. We really need better data, and there's no reason why we can't get in more of a prediction mode. It's not like surprise, surprise, we're having some heat waves in the summer. I think we can get better data on what places are going to be affected and how, and bring that data together with systems and service planning. So I think that could happen. Emphasizing just giving people adequate housing. That's a fundamental I've talked about already. I've talked about lived experience engagement. It's not just about people who've experienced homelessness, providers as well. I'm also a service provider alongside doing research, and so it's helpful because working in under-resourced and stretched settings, I can tell you that when somebody comes in very well-meaning and they're waving their hands around, they've got this brand new thing that you could be doing. You've got to try this new approach. We've got this, and the term toolkit, I can tell you, brings shudders to many people in the service provider environment, even webinar. It's just like, oh my God, these things come and go. And the work is so hard that you really kind of need to try and look at what's the existing work, what are the values and practices, and bring in approaches that will dovetail and align. So it's kind of, it fits. It's a slight nuance on something that's already being done. There will be invested people in provider communities. It's just making sure not to come in making some of those gaffes that unfortunately are the norm with toolkits and net new activities, because people are stretched and don't have time for it. And as well, too, remembering in this environment, and there are interviews that have been conducted with people experiencing homelessness about climate change, and the response you'll get is, well, that's not good, but every day I'm trying to get a meal, and I'm trying to avoid getting victimized by violence. Like every day is a crisis. So for providers and folks in this space, it can be a challenge because climate change can feel a little abstract against just the everyday survival crunch. But that is to say there's not interest, because there certainly is. There's many political people in the space who are wanting to get involved in solutions. Okay, and the other bit I'll just highlight is equity front and center in every conversation about anything to do with this. This should be true about any health problem, but is really asking, how are we looking at gender and how that plays out, sex and gender in this space? How are we looking at age? How are we looking at indigeneity? These are questions we need to be asking no matter what solution we're looking at. So a couple of examples. So on migration, one example, and we tried to do is make a suggestion, and ripping off some of the other really impactful reports and frameworks, is giving a suggestion, but then backing it up with some case examples, which you'll see if you do check out the framework ultimately. One is facilitating staying in place. It's not rocket science in many settings to figure out what are the most exposed geographic areas, cities, homes, and to try and look at because in the best case scenario, with some efforts at community level and in terms of infrastructure, people might be able to stay in place, which is ideal. And at worst is doing planned migration. So it's not family by family or or a whole community in response to a devastated landscape. Can a plan be made and migration being done in an organized way? Because in a disorganized way, that's a straight shot into poverty and homelessness and violence and the rest. And we look at the kinds of leverage that government will be interested in, sort of the impacts of unplanned migration on productivity, infrastructure pressures, labor pressures where people tend to arrive. And it may be a little cynical, but also optics is no city is looking that good when slums are on its borders. So we're just trying to come up with whatever levers might motivate government to be interested. On the exposure front, we emphasize, I've already touched on localized approaches, co-design, using peer-to-peer engagement, that kind of thing. Exposure we see as second string. Ideally, we're really getting up the prevention stream as much as possible. But if you, we're in the challenging scenario, homelessness is always this way, where you kind of need to do crisis response and prevention at the same time, which is hugely expensive, until prevention eliminates or greatly reduces the need for crisis response. Hard convincing governments to invest in that, because that could take a decade or decades. And then levers for providers. Providers, they don't want to see people suffering and dying as a result of weather extremes. So there's going to be the investment there. I think it's just really respecting the workloads and trying to work with people on, with providers on how to, you do just a good implementation science, right? Is trying to, how do you integrate these new approaches and fund them alongside what's already done? All right, I'm going to wrap up here just with a couple bits. I just, kind of as an image to sort of get, I guess you need to see the image. There we go. As an image to sort of capture, if there's a fundamental takeaway here, is we need to get out of the business of chasing around horses after they've left the barn, get upstream, get into prevention, and that's going to be far more cost effective and impactful. I've already mentioned the Canadian strategy that's coming together. I do really hope that it is more than just a strategy and more than just assessing risk. I hope that we really can get into a frame of rapid tests and action-oriented approaches that are funded appropriately to get more impactful in this space. I've already covered just the need to balance. Sure, we need to capture negative mental and physical health impacts, but how do we build resilient individuals, communities, and so on, who will be ready to engage in this? Really emphasizing inclusion and equity throughout. I think that's got to be fundamental. And I've already mentioned the stopping chasing horses after they've left the barn. So I'm just gonna stop sharing here. And yeah, so that's a little bit of a rapid fire run through what I've discovered so far as the key issues. I'm actually writing up the conclusion and implications of a paper that's a policy journal directed paper. It's bringing this together, and I just wrote literally an hour and change ago that this is to be considered a first draft and to be considered tentative because the data we have is not adequate. We're leaning on expert opinion. This is our best first crack, and there's a lot more to be done. But hopefully, this has been informative. And again, I hope I didn't cover too much territory that's old hat for this group, and maybe a few things were pulled from it. So thanks so much.
Great. Well, thank you very much, Sean. That was wonderful. A lot of information and presented very nicely. And I wouldn't worry too much about putting out a first draft. I think it's great that you've been doing this work and getting it out. We're open for questions. And while I wait for some people to raise their hand, maybe, I'll just say, I just noticed you talked about physical and mental health. I would also add the social health to WHO and also spiritual health.
Right.
Because I think those both are very important. And I really like what you said about doing something and being tuned in. I think that's a great message for all of us here, because so often we feel that our little contributions aren't, adding as much as, canceling a new oil drilling site or something like that, which is one of my goals at the moment. But that was very well put. And thank you very much too for, I put on into the chat your website.
Great.
And
great.
I'd just like to ask you a question about your research. If you could just tell us a bit more about your own specific research.
Sure.
You mentioned that grant, and I assume you got it. And
yeah, so I can tell you where that track's gone. So it started as very side of the desk, although it's steadily creeping towards the middle, which is kind of nice. We got I guess in part it was seeing how much interest and how much traction has come out of this effort. It's gone beyond what I would have anticipated for like a small knowledge mobilization grant, where you usually think I'll get a couple of papers or something out of it. So I'll just briefly, the rest of my life is I'm doing a large trial of a critical time intervention supporting young people exiting homelessness with Covenant House and Loft and CAMH in Toronto and Wellesley Institute. So doing an RCT of that. I'm doing some digital health work in severe mental illness, opioid use disorder, and psychosis. So I'm kind of a trialist in terms of clinical interventions, but where this has begun is we've done this initial landscape and we built this network of trying to keep folks engaged. And where I'm heading next with this, I have a couple of grants in right now. One is more with a global health lens. And what I would like to do, it's a small seed team building grant, but what I'm hoping to do, I think a couple of things need to happen. So one is I think we need some case studies from different parts of the world to articulate in much more detail about what are the issues, what are the experiences, who are the players, and to understand, what data is needed and what are some promising avenues for intervening and bringing attention to an issue. And I feel like some initial groundwork needs to be done there. So if we get that grant, it would be an international set of case studies, about a half a dozen in a bunch of localities. Kenya is one example, India, Australia, the southern United States, probably, and I know I'm forgetting one or two others, but it would just be trying to get some case studies, some groundwork that then ultimately would be a larger grant to actually run the case studies and get the data. And I think that's a start. I think, some of our groups suggested that also there'd be a benefit in scanning existing data sets to see what might be out there from which some mining could be done that could be useful and point in some helpful directions, because that's not clear right now, is where those data might be and what can be pulled. So that's one direction I'm interested in going in. The other is much more purely knowledge mobilization. I've got something in with McConnell Foundation. I had a positive experience with them. I was just reaching out because they have a big climate agenda right now, and they're just pulling it together. I just reached out to them in the fall to say, hey, it'd be interesting in hearing about who you're connecting with, what you're doing. In other words, I went to a funder and I didn't ask for money. And I think they found that kind of confusing. Because they're about a half hour into the call, the program officer said, you're not actually pitching something and asking for money. I was like, no, just I'd like to be introduced to people. So so that was confusing in a good way, because they ended up suggesting we put something in. And so we've got a proposal in now. We're in a second stage of review that would be, it would have and your group would be great to connect with if we're successful at this round or with something else, is with a Canadian lens, is continuing what we're doing here with a few focus areas. So one is continuing and having a deeper dive on inadequate housing and poverty in that frame, focusing on impoverished women, focusing on poverty as it interacts with younger and older age ranges, elderly and children and youth. And as well on the Indigenous side of things, we've got Indigenous collaborators, but I really want to look to just sort of work in parallel and collaborate, not necessarily try and build something that new. I think there's too much of that. My Indigenous scholar friends are tapped out with people reaching out with initiatives that we want them involved in. So I think, that's the intent, and it would be, some case examinations, some participatory action projects that would touch lived experience, systematic reviews, and just seeing if we can also do some case studies of where promising efforts in these areas may be happening across the country, which could kind of feed into the kinds of efforts that I'm talking about here, albeit with a Canada focus. That's their focus, is for McConnell. And so my frame on this front is I think I'm a little more interested in being a knowledge and research enabler than actually going out and gathering original data. And that's sort of how I'm seeing it so far, but it does feel like early days.
Thank you. I've just sort of can you hear me? Can you just nod your head? Yeah. Okay, good. I wonder if you could tell us a little bit more about the strategy that you mentioned that was in the works, and I assume that's by the federal government.
Oh, sorry, that I've been involved in. Yeah.
Yeah.
So it's this national adaptation strategy that it's got a few different buckets. So some in industry and sort of more kind of geography focused, and then there's a health arm to it. It's Jenna Lee Harper. I think she's the person that's been behind it at University of Edmonton, or University of Alberta in Edmonton. Anyways, that group has been coming together to try and look at what are short and medium term and long term targets for Canada in health, mental, physical health broadly. And then more recently, and I can share the link with the group, is they are focusing on the research end, is what data are needed and what scientists are needed to kind of plug in to inform efforts to achieve those targets. So that's been underway since the fall, and I've been involved in a few of those tables.
Okay, that's
Joanne,
great.
I saw your hand come up a little while ago there.
Oh yes, Joanne, and then
yes, and then Vic. First, thank you. That was really interesting. My agenda could not support another webinar. I'm really happy I did come. So that's for
great.
one thing. And but also would like to raise, unless I didn't hear properly, but at first you were saying something around, we already know, we have tons of data and we know it's affecting homeless people and so on. And at the end, you were we need more data. So I have a hard time reconciling which data are you looking
Right.
for, given that we have a lot, and that, and I think I was in total agreement with what you were saying at the beginning. So
yeah, sure. Let me, and this actually is, it was the science table just last Friday. I talked about just this point. So we have the most data about the people that need help the least. And that's where we have data sets, but often people experiencing housing precarity, homelessness, and poverty that goes along with that. Those are often the folks we have the least data about at a population level. They'll be the least connected, but we do have some, and I mean, we have some data-rich jurisdictions like Ontario with ICES, the OHIP database. That's arguably pretty good. I mean, it's not great, but it's pretty good in terms of it does capture homeless scenarios. They have an algorithm to identify homelessness, and you can reference that against weather events and so on. Other jurisdictions, and like in low and middle income countries, if you go global, there are vast swaths of the world where there's nothing. There's just nothing at a population level known. So what our colleague had suggested, that there are data sets out there that maybe there could be, some of them could have some potential, but then at the same time is looking at where the gaps are, and where, certainly at a country level, low-income countries, you're starting from scratch if you can motivate anyone to gather data there. And even a place like Canada, with all of our wealth of data, is looking at the gaps. There will be, for example, Indigenous communities for whom kind of population level data is lacking, and a different approach is needed. And so I think it's nuanced, I think. So there are data for sure, and there will be some really useful data, but we also need to be very aware of its limitations, I think. Hopefully that's helpful.
Thanks, Sean. Thanks, Joanne, for that. Vic?
Hi, everybody. Thanks for this, Sean. Two quick things. I want to welcome Ronald Ndosenjo, who's on this call. He's the newest member of our working group, and he's in Dar in Tanzania. So if you hear this, Ronald, welcome. I was going to ask you about toolkits, Sean, but I better not. I was wondering, though, if you have you got lessons about how to do this alignment well, or some of us call it synergy and harmonization and so on?
Yeah, I mean,
I
can, and I don't feel like I've arrived here, so I can let you know what I've tried so far. So one thing that's been helpful, and this is really a function of less of me, having good strategy. It's a function of some people connected with this work who have connections, for example, with the World Health Organization, and like my colleague Quam McKenzie and others, who what they've been able to do is say, okay, you've got an interesting point you're trying to make, an idea. Let me introduce you to the director of mental health for the World Health Organization, and some connecting there, and that's allowed me to do what I'd hoped to do, which is to kind of contribute our small slice of the pie here in with much larger organized efforts. That's happened on the Canadian level as well. And then with our framework, when we release it, we've done an analysis of like SDGs and World Health Organization and other organized efforts. And we've done tables where we line up each of our major strategy or issue suggestions and line it up with the specific policy alignments, with recommendation alignments with these other groups. So it's been part of it's been analysis to guide people to say, we're making this point, and it's not just us. You can find it here, here, and here in these other organized efforts. And then ultimately, with the framework we release, releasing a framework in a webinar and all that, I'm all too aware of how limited that is. I'm really hoping to find out in a strategic way what policymakers we need to approach individually to get this in front of, to have conversations to see if we can find where at a policy level this actually can be inserted. And our international network will help with that, because they'll know in their own jurisdictions who it might be good to have a discussion and share this with. And for many of them, hopefully it serves as a tool to validate the hard work they're trying to do. So I'd say in terms of impact, I don't know that we've had much impact yet, but I can keep you posted.
Great, thank you.
Well, thank you, everybody, for attending today. And a special thanks to you, Sean. Thanks for taking time out of your day
It's a pleasure.
to share your work with us and your ideas and thoughts, and also the scope of the work, and for bringing the local to the global and the global to the local. You've given us a very good example of global health and and also a very important part of our working group looking at health and climate change. All too often, mental health is often not considered as much as it should be. And yet it has really come to the fore now, I think, with COVID. And so perhaps that will maybe give your work a bit of a boost too. And if there's any way that the working group can assist you, you just let us know, let Lorna or I know. We'd be very pleased. And so again, thank you very, very much. It was fantastic.
Oh, it's a complete pleasure. Look forward to staying in touch, and all the best.
Okay, and we'll be posting the webinar on our website as well. So,
Fabulous. Great.
yeah.
Thanks, David.
Thanks a lot. Bye.
Okay.
Thanks.